Let's start with motion palpation of sacroiliac joint. First of all, I will position the patient on seated, and I will do the evaluation of sacroiliac joint in two phases. In one phase, I evaluate the right sacroiliac joint, and I will do the evaluation of sacroiliac joint, first of all, doing the flexion for the same side I am, and when the side of doctor instance. And after I will do the evaluation of the right sacroiliac joint, doing the motion of the patient to the opposite side, and then I will check the behavior of this motion on focus of the mobility of ilium, and also in focus of the mobility of sacrum. And then I also will check for the difference between the two joints mobility, and left sacroiliac joint and right sacroiliac joint. And I will ask the patient to cross the arms in front, and then I will use the 3 fingers, and then the superior finger will be on the upper part of the joint, sacroiliac joint, and the middle finger, the second finger here, on the middle part of sacroiliac joint, and the third finger will be in the inferior part of sacroiliac joint. And then I will position these 3 fingers inside the joint, not on the ilium and not on the sacrum, inside the joint. And then I'll do the motion like this. It will be completely passive motion. I just ask the patient to let me do it. And then when I do the flexion, I will first of all focus on sacrum. And then focus on sacrum, I will do the flexion for the same side I am, the lateral bending. And then what I expect for this motion is that the sacrum go into the joint and down to anteroinferior position. We go into the joint and down. And about the ilium, I will do first this 2 or 3 movements to evaluate the sacrum, and after that I will just focus in the same place I will position my fingers, but now I will focus my perception on the motion, the movement of the ilium, and then I will do more 2 or 3 times this motion. And what I expect is that the ilium go into the joint and also up. This is what I expect. This is the normal movement of this testing. And now I'll go for the second phase of this evaluation of the right sacroiliac joint. In the second phase, I will position the fingers, how I explained to you, the 3 fingers, superior, medial, and inferior part of sacroiliac joint, into the joint here. And then I will move the patient to the opposite side. And what I expect for the sacrum is that the sacrum goes out and up. And then I do the motion 2 or 3 times to perceive very well the motion of the sacrum. And after that, I will focus the palpation on the ilium. And then I do 2 or 3 times this motion, and what I expect is that the ilium goes out and down. That is the normal motion for this testing.
Reviewing the anatomical model, we will position the 3 fingers on the sacroiliac joint. Of course, I must also observe the 2 patterns of movements on both sides, left and right sacroiliac. The objective, in addition to listening, is to observe on which side there is more movement or which side has more restriction, defining where I should adjust primarily. You must consider that I will palpate not on the surface of the sacrum or the surface of the ilium, but I shall palpate into the joint like this. To perform the test, I will divide the test in 2 phases. The first phase being the tilt of the spine toward the examiner, testing the left joint, and then I will tilt the spine in the opposite side of the examiner, even testing the left joint. And then I will repeat the test to the other joint. And then beyond trying to listen it, I will also compare the pattern of restriction of both joints. When I firstly tilt the spine to the same side, I will first focus my perception of the movement of the sacrum, and then perform 2 or 3 movements. And then I direct my attention to the perception of movements of the iliac for more 2 or 3 movements. And after, I will change my position and test the other side of the joint, the right sacroiliac joint. When I tilt the spine to the same side of the examiner, having focus on the motion of the sacrum, I will feel the normal tendency of motion of the sacrum that will be going into the joint and down, or I can say going to anteroinferior position. And when I change my focus to the iliac bone, I will perceive the normal motion going into the joint and up. And so, tilting to the side of the examiner, the sacrum will go down and into the joint to anteroinferior position, and the iliac will go up and into the joint. The sacrum goes into the joint and down. That's the motion of the sacrum, normal motion. And the normal pattern of motion of the left ilium, when I tilt the spine to the left or side of the examiner, will be going up and into the joint, up and into the joint. And then, to have more accuracy to the test, I must first of all keep my focus on the pattern of motion of the sacrum during 2 or 3 movements, and then do another 2 or 3 movements to pay attention on the pattern of motion of the ilium. 2 or 3 movements observing the behavior of the sacrum. And after that, 2 or 3 movements observing the behavior of the ilium. If the sacrum or the ilium don't go through the right pattern of motion, there is a restriction or fixation of the opposite sense of motion. In the second phase of the test, now I will go on palpating the left sacroiliac joint. But now I will tilt the spine to the opposite side of the examiner. I will palpate the left sacroiliac joint, but I will tilt the spine to the right side. And then I will also take focus, first of all, in the sacrum, and after I will focus in the pattern of motion of the ilium. That will be a different pattern for these 2 different bones. During this movement, when I palpate the sacrum, the pattern of normal motion for the sacrum will be going up and out. Up and backwards. And in case of the behavior of the ilium, when I flexionate the spine laterally to the opposite side, the ilium will go down and out to the joint, down and out to the joint.